Question 1. A 68-year-old client with chronic heart failure is receiving high-dose furosemide therapy. During the morning assessment, the nurse notes that the client complains of increasing fatigue, muscle weakness, and constipation. The cardiac monitor shows flattened T waves and the presence of U waves. Which laboratory value would the nurse expect to find? A. Potassium 6.2 milliequivalents per liter. B. Potassium 2.9 milliequivalents per liter. C. Potassium 4.5 milliequivalents per liter. Or D. Potassium 5.4 milliequivalents per liter. The answer is B. Potassium 2.9 milliequivalents per liter. The rationale is loop diuretics, such as furosemide, cause potassium wasting. Muscle weakness, constipation, flattened T waves, and U waves are classic manifestations of hyperkalemia. Question 2. A client admitted with diabetic ketoacidosis, DKA, has an initial potassium level of 5.8 milliequivalents per liter. The healthcare provider prescribes IV insulin therapy. Which nursing action is the priority before initiating the insulin infusion? A. Start the insulin infusion immediately. B. Verify that urine output is adequate. C. Administer IV potassium chloride. Or D. Restrict the client's fluid intake. The answer is B. Verify that urine output is adequate. The rationale is insulin drives potassium into the cells, which can cause rapid hypokalemia. Adequate kidney function and urine output must be confirmed before potassium shifts occur. Question 3. A nurse reviews laboratory results for a client receiving spironolactone for management of hypertension. Which electrocardiogram change should the nurse monitor for as an early indicator of potassium imbalance? A. ST depression. B. Prominent U waves. C. Peaked T waves. Or D. Prolonged PR interval. The answer is C. Peaked T waves. The rationale is spironolactone is a potassium-sparing diuretic. Hyperkalemia often produces tall peaked T waves on ECG. Question 4. A client with severe vomiting for 3 days is admitted to the medical unit. The nurse anticipates the client may develop which potassium imbalance? A. Hyperkalemia due to cellular destruction. B. Hypokalemia due to gastrointestinal losses. C. Hyperkalemia due to decreased renal excretion. Or D. Normal potassium levels due to homeostatic mechanisms. The answer is B. Hypokalemia due to gastrointestinal losses. The rationale is prolonged vomiting causes significant potassium loss, leading to hypokalemia. Question 5. A client with chronic kidney disease presents with muscle weakness and palpitations. The laboratory report indicates a potassium level of 6.5 milliequivalents per liter. Which medication should the nurse anticipate administering first to stabilize the client's cardiac membrane? A. Sodium polystyrene sulfonate. B. Calcium gluconate. C. Regular insulin. Or D. Furosemide. The answer is B. Calcium gluconate. The rationale is calcium gluconate stabilizes myocardial cell membranes and protects the heart from the effects of severe hyperkalemia. Question 6. A nurse is caring for a client receiving IV potassium chloride through a peripheral line. The client suddenly reports burning at the IV site. Which action should the nurse take first? A. Stop the infusion immediately. B. Slow the infusion rate. C. Apply a warm compress. D. Flush the IV line. Answer.
A. Stop the infusion immediately. Rationale. IV potassium is highly irritating. Burning may indicate infiltration or phlebitis, requiring immediate discontinuation. Question 7. A post-operative client with nasogastric suction develops hypokalemia. Which clinical manifestation should the nurse expect? A. Hyperactive bowel sounds. B. Bradycardia with peaked T waves. C. Decreased deep tendon reflexes. D. Severe hypertension. Answer. C. Decreased deep tendon reflexes. Rationale. Hypokalemia causes neuromuscular weakness, including reduced reflexes. Question 8. A client receiving potassium replacement therapy asks why potassium must be diluted before IV administration. Which explanation by the nurse is most accurate? A. Potassium can cause cardiac arrest if pushed rapidly. B. Dilution prevents kidney damage. C. Potassium must be diluted to improve absorption. D. Dilution reduces risk of infection. Answer. A. Potassium can cause cardiac arrest if pushed rapidly. Rationale. IV potassium must never be given IV push because rapid infusion can cause fatal arrhythmias. Question 9. A nurse assesses a client with hyperkalemia. Which electrocardiogram finding requires immediate intervention? A. Flattened T waves. B. Presence of U waves. C. Widened QRS complex. D. Sinus tachycardia. Answer. C. Widened QRS complex. Rationale. A widened QRS complex indicates worsening hyperkalemia and risk of ventricular arrhythmias. Question 10. A client receiving digoxin therapy develops hypokalemia. Why does hypokalemia increase the risk of digoxin toxicity? A. Potassium enhances digoxin excretion. B. Low potassium increases digoxin binding to cardiac cells. C. Hypokalemia decreases digoxin absorption. D. Potassium neutralizes digoxin. Answer. B. Low potassium increases digoxin binding to cardiac cells. Rationale. Hypokalemia enhances digoxin effects on the myocardium, increasing the risk of toxicity. Question 11. A client admitted with diabetic ketoacidosis has the following laboratory results on admission. Potassium 5.7 milliequivalents per liter, glucose 620 milligrams per deciliter, arterial pH 7.18. 1 hour after initiation of insulin therapy, the cardiac monitor shows new onset premature ventricular contractions. Which laboratory change most likely explains this finding? A. Rapid increase in serum sodium. B. Rapid decrease in serum potassium. C. Increase in serum bicarbonate. D. Decrease in blood glucose level. Answer. B. Rapid decrease in serum potassium. Rationale. Insulin shifts potassium from the extracellular space into cells. This can rapidly lower serum potassium levels, predisposing the client to arrhythmias such as PVCs. Question 12. A client with severe hyperkalemia, potassium 6.8 milliequivalents per liter, is receiving treatment. Which intervention works by shifting potassium from the extracellular space into the intracellular compartment? A. Sodium polystyrene sulfonate. B. Regular insulin with dextrose. C. Calcium gluconate. D. Hemodialysis. Answer. B. Regular insulin with dextrose. Rationale. Insulin drives potassium into cells. Dextrose is given concurrently to prevent hypoglycemia.
Question 13. A nurse is caring for a client receiving potassium replacement for severe hypokalemia.
Which clinical condition would make potassium administration particularly dangerous? A. Urine output less than 30 milliliters per hour. B. Sinus tachycardia. C. Mild dehydration. D. Low serum magnesium. Answer. A. Urine output less than 30 milliliters per hour. Rationale. Potassium must not be administered when renal function is inadequate because potassium can accumulate rapidly, leading to life-threatening hyperkalemia. Question 14. A client receiving total parenteral nutrition, or TPN, develops muscle weakness and ECG changes including U waves and ST depression. Which potassium level would the nurse expect? A. 6.2 milliequal per liter. B. 5.5 milliequals per liter. C. 3.0 milliequals per liter. D. 4.3 milliequals per liter. Answer. C. 3.0 milliequals per liter. Rationale. U waves and ST depression are characteristic ECG changes in hypokalemia. Question 15. A nurse is caring for a client with hyperkalemia related to acute renal failure. Which dietary selection made by the client indicates a need for further teaching? A. White rice with grilled chicken. B. Apple slices and toast. C. Baked potato with avocado. D. Pasta with olive oil. Answer. C. Baked potato with avocado. Rationale. Potatoes and avocados are high in potassium and should be avoided in hyperkalemia. Question 16. A client with prolonged diarrhea is admitted with suspected electrolyte imbalance. Which ECG finding would most strongly suggest hypokalemia? A. Tall peaked T waves. B. Shortened QT interval. C. Presence of prominent U waves. D. Widened QRS complex. Answer. C. Presence of prominent U waves. Rationale. U waves are a hallmark ECG change associated with hypokalemia. Question 17. A client undergoing hemodialysis suddenly develops muscle weakness and cardiac rhythm changes. The potassium level is 7.1 milliequivalents per liter. Which complication is the nurse most concerned about? A. Ventricular fibrillation. B. Atrial flutter. C. Sinus bradycardia. D. First-degree heart block. Answer. A. Ventricular fibrillation. Rationale. Severe hyperkalemia can lead to life-threatening ventricular arrhythmias, including ventricular fibrillation. Question 18. A nurse reviews laboratory results for a client receiving amphotericin B therapy. Which potassium imbalance is most likely associated with this medication? A. Hyperkalemia due to renal potassium retention. B. Hypokalemia due to renal potassium wasting. C. Hyperkalemia due to cellular breakdown. D. No potassium imbalance is associated with this drug. Answer. B. Hypokalemia due to renal potassium wasting. Rationale. Amphotericin B can cause renal tubule damage, leading to potassium loss and hypokalemia. Question 19. A client receiving high-dose insulin therapy for hyperkalemia begins to exhibit confusion, diaphoresis, and tremors. Which complication should the nurse suspect? A. Hypernatremia. B. Hypoglycemia. C. Metabolic acidosis. D. Hypercalcemia. Answer. B. Hypoglycemia. Rationale. Insulin therapy lowers blood glucose levels. Therefore, hypoglycemia is a common complication if glucose supplementation is inadequate. Question 20. A client with hypokalemia secondary to diuretic therapy is prescribed oral potassium chloride. Which instruction should the nurse provide to reduce gastrointestinal irritation? A. Take the medication on an empty stomach. B. Crush the tablet before swallowing. C. Take the medication with food and a full glass of water. D. Take the medication immediately before bedtime. Answer. C. Take the medication with food and a full glass of water. Rationale. Oral potassium can irritate the gastrointestinal tract, so it should be taken with meals and sufficient fluid. Question 21. A client with diabetic ketoacidosis is receiving IV insulin therapy. 4 hours later, the laboratory results are potassium 3.1 milliequivalents per liter, glucose 240 milligrams per deciliter, and urine output 50 milliliters per hour. Which action should the nurse take first? A. Continue the insulin infusion as prescribed. B. Notify the provider and anticipate potassium replacement. C. Administer sodium bicarbonate. D. Restrict fluids to prevent overload. Answer. B. Notify the provider and anticipate potassium replacement. Rationale. Insulin shifts potassium into cells, often causing rapid hypokalemia during treatment of DKA. A potassium level of 3.1 milliequivalents per liter is dangerously low and requires replacement to prevent arrhythmias. Question 22. A nurse is reviewing laboratory results for 4 hospitalized clients. Which client requires immediate intervention? A. Potassium 3.4 milliequivalents per liter with mild muscle cramps. B. Potassium 4.8 milliequivalents per liter with normal ECG. C. Potassium 6.4 milliequivalents per liter with peaked T waves. D. Potassium 3.6 milliequivalents per liter with normal vital signs. Answer. C. Potassium 6.4 milliequivalents per liter with peaked T waves. Rationale. Hyperkalemia above 6.0 milliequivalents per liter with ECG changes is a medical emergency due to risk of lethal arrhythmias. Question 23. A client with heart failure is taking lisinopril and spironolactone. Which laboratory value would require immediate follow-up by the nurse? A. Potassium 5.8 milliequa per liter. B. Sodium 138 milliequa per liter. C. Creatinine 1.1 milligrams per deciliter. D. Chloride 100 milliequa per liter. Answer. A. Potassium 5.8 milliequa per liter. Rationale. ACE inhibitors and potassium-sparing diuretics both increase potassium levels, placing the client at high risk for hyperkalemia. Question 24. A client receiving IV potassium replacement has the following prescription: potassium chloride 40 milliequa in 500 milliliters normal saline to infuse over 4 hours. Which nursing action is most appropriate? A. Administer using an infusion pump. B. Infuse the solution rapidly if potassium is very low. C. Administer IV push for faster correction. D. Dilute the potassium in sterile water only. Answer. A. Administer using an infusion pump. Rationale. IV potassium must always be administered using an infusion pump to prevent accidental rapid infusion and cardiac arrhythmias. Question 25. A client with severe burns is admitted to the intensive care unit. During the first 24 hours after injury, the nurse anticipates which potassium imbalance? A. Hypokalemia due to fluid shifts. B. Hyperkalemia due to cellular destruction. C. Hypokalemia due to renal excretion. D. Normal potassium due to compensatory mechanisms. Answer. B. Hyperkalemia due to cellular destruction. Rationale. Extensive tissue damage releases intracellular potassium into the bloodstream, causing hyperkalemia. Question 26. A nurse is caring for a client receiving potassium supplements for hypokalemia. Which clinical finding indicates the therapy has been effective? A. Increased muscle strength and normal ECG. B. Development of peaked T waves. C. Persistent muscle weakness. D. Decreased bowel sounds. Answer. A. Increased muscle strength and normal ECG. Rationale. Correction of hypokalemia improves neuromuscular function and restores normal cardiac conduction.
Question 27. A client with metabolic acidosis develops hyperkalemia. Which physiological mechanism explains this finding? A. Potassium moves into cells in exchange for hydrogen ions. B. Hydrogen ions move into cells while potassium moves out. C. The kidneys excrete potassium rapidly. D. Potassium binds to plasma proteins. Answer. B. Hydrogen ions move into cells while potassium moves out. Rationale. In metabolic acidosis, hydrogen ions enter cells to buffer the acid, forcing potassium out into the extracellular fluid. Question 28. A client hospitalized with potassium 2.8 milliequivalents per liter reports palpitations. Which ECG finding would the nurse most likely observe? A. Tall peaked T waves. B. Widened QRS complexes. C. Prominent U waves. D. Shortened PR interval. Answer. C. Prominent U waves. Rationale. Hypokalemia commonly produces U waves and flattened T waves on ECG. Question 30. A nurse is assessing a client receiving potassium-sparing diuretics. Which clinical manifestation would most strongly indicate developing hyperkalemia? A. Constipation and lethargy. B. Muscle weakness and paresthesias. C. Severe hypertension. D. Hyperactive reflexes. Answer. B. Muscle weakness and paresthesias. Rationale. Hyperkalemia often presents with neuromuscular symptoms including weakness, numbness, and tingling. Question 30. A client with chronic kidney disease has a potassium level of 6.7 milliequivalents per liter and ECG changes. The provider prescribes several medications. Which medication removes potassium from the body through the gastrointestinal tract? A. Calcium gluconate. B. Sodium polystyrene sulfonate. C. Regular insulin. D. Sodium bicarbonate. Answer. B. Sodium polystyrene sulfonate. Rationale. Sodium polystyrene sulfonate binds potassium in the intestine and removes it through the stool. Question 31. A client with severe hypokalemia, potassium 2.7 milliequivalents per liter, continues to have persistent low potassium levels despite repeated IV potassium replacement. The nurse reviews the laboratory results and notes a magnesium level of 1.1 milligrams per deciliter. Which action should the nurse anticipate? A. Increase the potassium infusion rate. B. Administer magnesium sulfate as prescribed. C. Restrict potassium intake temporarily. D. Begin calcium gluconate infusion. Answer. B. Administer magnesium sulfate as prescribed. Rationale. Hypomagnesemia prevents potassium from being retained in cells and kidneys. Potassium levels often cannot be corrected until magnesium deficiency is treated. Question 32. A client receiving continuous cardiac monitoring develops tall, peaked T waves, muscle weakness, and a potassium level of 6.9 milliequivalents per liter. Which prescription should the nurse implement first? A. Administer sodium polystyrene sulfonate. B. Administer IV calcium gluconate. C. Start loop diuretic therapy. D. Prepare the client for dialysis. Answer. B. Administer IV calcium gluconate. Rationale.
Calcium gluconate stabilizes cardiac cell membranes and is the priority intervention to protect the heart from arrhythmias in severe hyperkalemia. Question 33. A nurse is caring for 4 clients with potassium imbalances. Which client should the nurse assess first? A. Potassium 5.5 milliequivalents per liter with mild nausea. B. Potassium 2.9 milliequivalents per liter with muscle cramps. C. Potassium 6.2 milliequivalents per liter with widened QRS complex. D. Potassium 3.3 milliequivalents per liter receiving oral potassium. Answer. C. Potassium 6.2 milliequivalents per liter with widened QRS complex. Rationale. Hyperkalemia with ECG changes indicates impending life-threatening arrhythmias and requires immediate assessment. Question 34. A client with acute kidney injury has potassium 6.5 milliequivalents per liter. The provider prescribes insulin with dextrose. What is the primary purpose of the dextrose? A. Prevent insulin-induced hypoglycemia. B. Accelerate potassium excretion. C. Stabilize the cardiac membrane. D. Prevent metabolic alkalosis. Answer. A. Prevent insulin-induced hypoglycemia. Rationale. Insulin shifts potassium into cells. Dextrose is given to prevent hypoglycemia caused by insulin administration. Question 35. A client with prolonged nasogastric suction develops hypokalemia. Which acid-base imbalance does the nurse anticipate accompanying this electrolyte disorder? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer. C. Metabolic alkalosis. Rationale. Gastric suction removes hydrochloric acid from the stomach, leading to metabolic alkalosis and potassium loss. Question 36. A client receiving high-dose beta-agonist therapy for status asthmaticus develops a potassium level of 3.0 milliequivalents per liter. Which mechanism explains this electrolyte change? A. Increased renal potassium excretion. B. Potassium shifting into cells. C. Destruction of red blood cells. D. Increased gastrointestinal potassium loss. Answer. B. Potassium shifting into cells. Rationale. Beta-agonists stimulate cellular uptake of potassium, leading to decreased serum potassium levels. Question 37. A nurse is caring for a client with severe hyperkalemia. Which ECG change indicates the most advanced stage of this electrolyte imbalance? A. Tall peaked T waves. B. Flattened P waves. C. Widened QRS complex. D. Ventricular fibrillation. Answer. D. Ventricular fibrillation. Rationale. Ventricular fibrillation represents a terminal arrhythmia associated with severe untreated hyperkalemia. Question 38. A client with potassium 2.6 milliequivalents per liter reports increasing fatigue and constipation. Which additional assessment finding should the nurse expect? A. Hyperactive bowel sounds. B. Decreased intestinal motility. C. Severe hypertension. D. Increased deep tendon reflexes. Answer. B. Decreased intestinal motility. Rationale. Hypokalemia causes smooth muscle weakness, leading to decreased bowel motility and constipation. Question 39. A client receiving IV potassium chloride suddenly develops redness, swelling, and pain at the IV site. What is the nurse's priority action? A. Reduce the infusion rate. B. Stop the infusion and assess the IV site. C. Flush the IV line with saline. D. Apply a cold compress. Answer. B. Stop the infusion and assess the IV site. Rationale. Potassium is highly irritating to veins. Signs of infiltration or phlebitis require immediate discontinuation of the infusion. Question 40. A client with hyperkalemia receives sodium bicarbonate therapy. Which effect explains how this treatment lowers potassium levels? A. Potassium is excreted in the stool. B. Potassium shifts into cells during correction of acidosis. C. Potassium is neutralized in the bloodstream. D. Potassium binds with bicarbonate in plasma. Answer. B. Potassium shifts into cells during correction of acidosis. Rationale. Correcting acidosis with bicarbonate drives potassium back into cells, lowering serum potassium levels. Question 41. A nurse is reviewing the laboratory results of 4 hospitalized clients. Which client should the nurse assess first? A. A client with potassium 3.2 milliequivalents per liter receiving oral potassium supplements. B. A client with potassium 5.9 milliequivalents per liter reporting mild nausea. C. A client with potassium 6.6 milliequivalents per liter whose cardiac monitor shows loss of P waves. D. A client with potassium 3.4 milliequivalents per liter and muscle cramps. The answer is C. A client with potassium 6.6 milliequivalents per liter whose cardiac monitor shows loss of P waves. Rationale. Severe hyperkalemia with ECG changes, loss of P waves, signals dangerous cardiac conduction abnormalities that can rapidly progress to fatal arrhythmias. Question 42. A client with chronic kidney disease presents with potassium 6.8 milliequivalents per liter. The nurse administers calcium gluconate as prescribed. What is the primary therapeutic effect of this medication? A. It removes potassium from the bloodstream. B. It increases renal potassium excretion. C. It stabilizes myocardial cell membranes. D. It shifts potassium into the intracellular space. The answer is C. It stabilizes myocardial cell membranes. Rationale. Calcium gluconate does not lower potassium levels, but protects the heart by stabilizing cardiac membranes. Question 43. A client with hypokalemia is receiving IV potassium replacement at 10 milliequivalents per hour. During assessment, the nurse notes the client has developed new irregular heartbeats. Which action should the nurse take first? A. Stop the potassium infusion and assess the client. B. Increase the potassium infusion rate. C. Administer sodium bicarbonate. D. Encourage oral potassium intake. The answer is A. Stop the potassium infusion and assess the client. Rationale. Cardiac rhythm changes during potassium infusion may indicate rapid electrolyte shifts or infusion complications and require immediate evaluation. Question 44. A client with diabetic ketoacidosis initially had potassium 6.6 milliequivalents per liter. 6 hours after starting insulin therapy, the potassium level is now 3.0 milliequivalents per liter. Which complication is the nurse most concerned about? A. Ventricular arrhythmias. B. Hyperglycemia. C. Metabolic alkalosis. D. Hypertension. The answer is A. Ventricular arrhythmias. Rationale. Rapid drops in potassium during insulin therapy can lead to dangerous cardiac arrhythmias. Question 45. A client admitted with severe diarrhea has potassium 2.8 milliequivalents per liter. Which additional laboratory finding would the nurse most likely observe? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D.
respiratory alkalosis? The answer is A, metabolic acidosis. Rationale. Severe diarrhea causes loss of bicarbonate from the gastrointestinal tract, resulting in metabolic acidosis along with potassium loss.
Question 46. A nurse is caring for a client with hyperkalemia who is receiving sodium polystyrene sulfonate. Which outcome indicates that the medication has been effective? A. Decreased serum potassium level. B. Increased urinary potassium excretion. C. Improved calcium levels. D. Reduced blood glucose levels. Answer. A. Decreased serum potassium level. Rationale. Sodium polystyrene sulfonate binds potassium in the gastrointestinal tract and removes it through feces, lowering serum potassium. Question 47. A client with hypokalemia complains of increasing abdominal distension. Which complication should the nurse suspect? A. Paralytic ileus. B. Bowel obstruction. C. Acute pancreatitis. D. Peptic ulcer disease. Answer. A. Paralytic ileus. Rationale. Hypokalemia weakens smooth muscle activity, which can lead to decreased bowel motility and paralytic ileus. Question 48. A nurse is teaching a client with recurrent hypokalemia about potassium-rich foods. Which food should the nurse recommend? A. Bananas. B. White rice. C. Crackers. D. Cottage cheese. Answer. A. Bananas. Rationale. Bananas are high in potassium and commonly recommended to help correct or prevent hypokalemia. Question 49. A client with hyperkalemia is receiving regular insulin and dextrose. Which laboratory value should the nurse monitor most closely after treatment? A. Serum glucose. B. Serum calcium. C. Serum magnesium. B. Serum sodium. Answer. A. Serum glucose. Rationale. Insulin therapy lowers blood glucose levels, placing the client at risk for hypoglycemia. Question 50. A nurse is caring for a client with potassium 7.0 milliequivalents per liter and severe ECG changes. Despite medication therapy, the potassium remains elevated. Which intervention should the nurse anticipate next? A. Hemodialysis. B. Oral potassium supplements. C. Administration of potassium-sparing diuretics. D. Increased dietary potassium intake. Answer. A. Hemodialysis. Rationale. Hemodialysis is the most effective and rapid method for removing potassium in severe or refractory hyperkalemia, especially in clients with renal failure.
Alright, before you go, let's lock this in. Potassium imbalances are one of the most dangerous electrolyte disorders you'll see in Med-Surg and on the NCLEX. The exam loves to test subtle clues: ECG changes, medication interactions, renal failure, insulin shifts, and priority interventions. If you can recognize those patterns quickly, you'll save time on the exam and avoid the traps that confuse many test takers. If this video challenged your thinking, that's exactly the goal. NCLEX questions aren't meant to be easy. They're meant to test how you analyze, prioritize, and make safe clinical decisions. Before you leave, re-watch the questions that slowed you down. Practice identifying the ECG clues for potassium imbalance, and train your mind to spot priority hyperkalemia emergencies. And if you want more high-level NCLEX drills like this, make sure you subscribe to MCQs Master 101, where we break down the hard questions most students miss so you can walk into your exam with confidence. Thanks for studying with me, and I'll see you in the next NCLEX review.